Hello, everyone. Thanks for joining me. This is Russell Linville, physical therapist. This is Advanced Plyometric Training, Physiological Foundations, and Program Design. And this is, of course, intended for Franklin Pierce University Therapeutic Exercise Course. So without further ado, let's get into it. The objectives here of this lecture, we're going to explore the biomechanical and physiological basis of plyometric training. We're also going to examine the phases of plyometric movement and their relevance to neuromuscular adaptations. And we're going to analyze advanced parameters for designing effective plyometric programs. I'll give you some examples of that a little later on. So what is plyometric training? So we know about different types of strength and conditioning work. We know about, in this course, you've obviously learned about the different variables that go into physical fitness and training and exercise prescription. Plyometric is on the end of that spectrum of getting someone back to their desired task or sport. As we'll get into later, it involves not only power output, force production, but also in some cases randomization of movement patterns and things of that nature to mimic one's sport. So all that can be kind of defined as plyometrics, where we're working on quick changes of direction or explosiveness. And we not only look at that for lower extremity, but also upper extremity as well. Think of throwing sports. We need to be able to rapidly move the arm through space just as importantly as we do with our turf and field sports and court sports. We have to rapidly move our lower extremities through space. So with that said, what is the definition of plyometric training? Well, it's quick, powerful movements involving an eccentric contraction immediately followed by an explosive concentric contraction, and that's as simple as it can get, and we'll get into that in more detail later. The purpose of plyometric training is to improve the rate of force production, neuromuscular control, and injury resilience. And there's something called this integrated performance paradigm. It's movement precision achieved through the cycle of eccentric loading, isometric stabilization, and concentric unloading. And that's kind of how I think of plyometrics. So what are some of the evidence-based benefits of plyometric training? Well, injury prevention is one. As a physical therapist, we're going to have to really understand this concept. And this is proven time and again in things like the FIFA 11 and other sports injury prevention programs. While they're not all perfect, they don't prevent all injuries. They are better and help the athlete adapt and achieve graded exposure. And so you can see some of the ones listed here on the right and some of the different movement variables that you've learned in this course, if they're incorporated into those programs or not. So performance gains is another reason plyometric training is great. It's documented increase in vertical jump height, sprint performance, and overall anaerobic power. So if you want to be more of a fast twitch athlete, plyometric training is going to be what you need. Again, I want to just point out there that most times sports involve full body movements, including upper extremity. So it's important to incorporate that when necessary, or to individualize some of the plyometric drills for your athletes' return to sport needs. Picture this: a big weighted tire like the two individuals in this picture are pushing. You have a football lineman. Are you just going to work on lower extremity strength, or are you going to work also on some upper extremity plyometric power so that they can push people over and block people and hit people? I think you know the answer to that, and so that's why I threw this picture in there. And then finally, neuromuscular efficiency. There's significant improvements in dynamic balance and proprioception across the lower extremity exercises, and that's because we're starting to train some of those proprioceptive and neuromuscular pathways. And so we have, obviously, you're not going to throw a novice individual into plyometrics right away. You want to make sure that they're at least intermediate or advanced movers, and then you start to incorporate some of these higher dynamic movements in. So what is integrated performance paradigm? Well, it's sort of this cycle here, right? And we'll talk about the eccentric, the isometric, or maybe not really isometric, but amortization phase we'll talk about in a second, and then the concentric portion of what actually constitutes a plyometric exercise. So with all human movement that's fast paced and dynamic, we're going to have some sort of core stabilization to help us control or coordinate the movement. If we're quote unquote sloppy movers, however you want to picture that, maybe it's someone doing a single leg squat and they have a lot of dynamic knee valgus, or they're getting some trunk rotation or some pelvic rotation because they can't control the levers that they're trying to control. You have to have some sort of core stabilization, or what we might call neuromuscular control, to start to implement in faster paced eccentric force reduction or slowing down a joint's movement to concentric force production or speeding up a joint's movement. And if we don't have that core stabilization first, we're not going to be able to efficiently move. There is something called the stretch shortening cycle, which is very important to understand. And it's a central component of plyometrics. It enables rapid force generation. Again, the three phases of a plyometric are going to be the eccentric phase, which is a pre-stretch or loading phase where potential energy is stored, an amortization phase, super important to understand this, amortization phase, which is a brief isometric period between eccentric and concentric phases, critical for the transfer of energy. Think of it as running. This is an example. This isn't exactly right, but running, you quickly stop and turn around and go back, right? It's the amortization phase is how quickly you can stop and get out of it. And in the example of a plyometric exercise, which you'll see down here at the bottom in a second, is a counter movement jump, or let's call it a vertical jump. When you drop down into that hip hinge, knee bent position, how quickly can you get out of that flex position and get triple extended up, right? It's the rate at which you can change from eccentric to concentric. And so that's the last phase, is concentric. It's the explosive release of stored energy to create maximum force output. And an example, again, is a counter movement jump. Again, squatting down before you jump, you're preloading those tissues. You're putting tension through some of the elastic structures. There's that brief pause to shift your energy into the concentric or a shortening position to explode upward. That's what this is all about, the stretch shortening cycle. So what are the biomechanics of the amortization phase? Well, there is an importance of minimizing amortization. So the quicker that you can go from eccentric to concentric, the more explosive you will be. So a rapid transition from eccentric to concentric maximizes stored energy conversion. What is electromechanical delay? Well, reducing electromechanical delay improves performance by retaining stored potential energy. So if we can kind of fixate here on the neural conductivity, if there's a delayed signal to the muscles to contract, meaning motor unit recruitment and some of the other neuroadaptive processes, we're talking here about some of the feedback loops, like with Golgi tendon organs and things of that nature, muscle spindles, ability to relay information back to the central nervous system. If we can reduce the delay in signaling, then our ability to contract will be quicker and our plyometric exercise will be more powerful. What about clinical application? Well, training shorter amortization times improves explosive power, critical and athletic movements such as jumping and sprinting. Here's an example. This is from a YouTube page. Actually, it's kind of pretty good. I just looked through a few videos. Pretty good stuff. I think this guy's a master of science and strength conditioning. He's going to just kind of break down this amortization, eccentric amortization concentric phase. So you'll see him jump here. You see him squat down, jump up. And now he'll break it down in slow motion to give you guys a little bit better visual here of what's going on. So here's the slow-mo. He's getting his stance ready. You'll see him drop down. This is the eccentric phase, the preloading. That pause, the ability to switch from eccentric to concentric, that's amortization. And of course, we know the triple extension concentric phase. So what are key physiological mechanisms in plyometrics? Well, there's elastic components of muscle. We know this. Contractile tissue has elastic properties. So let's break this down even further. There's a concept here called series elastic components, or SEC. This stores energy during the loading or eccentric phase, which is then released during the concentric phase. You have parallel elastic components, which is PEC, contributes to muscle stability and elasticity. And then you have contractile components, primary force generators augmented by stored elastic energy. That word augmented means it's assisted by, correct? So we have our normal myosin and actin, and some of the microscopic physiological things that happen with the muscle contraction. That's your primary force generator. It's augmented by stored elastic energy from other tissues, and we'll go over that in the next slide more in depth. So the impact on force production here, meaning the elastic components impact on force production, is enhanced energy efficiency and concentric force from rapid transition through the stretch shortening cycle. How does this look? Well, if I can get my mouse out here, and hopefully you can see my mouse, we start here at the top left, and we have here, of course, muscle spindle is excited. It sends signals back to the central nervous system, recruits a motor neuron to activate the muscle, and that's going to be like this elongation of the storage elastic component, the SEC. Okay. Once the central nervous system gets that signal, it sends a signal to contract the muscle, recruit motor units, and that period of central nervous system changing direction, if you will, or volitional change of direction, is that storage of elastic energy. So as you drop down into the eccentric portion, you're pulling back, in essence, this rubber band. You're storing this potential energy. And then once you want to activate the concentric portion, that's like you releasing the rubber band. And you can see how this stored potential energy in some of the elastic tissues of the whatever you're trying to activate is released, and energy is produced. And so here's another example of this. If we look at the picture on the left, we see this number 1 pre-landing or preparatory period. Imagine this person's landing from a jump. You can see that as they're about to land, their MT muscle tendon unit, they have similar EMG activities here in both the hamstring, the quads, and well, they're not showing the calf here, but they're about to land. Pre-activity in the muscles, getting ready for landing. Once they land, you can see that the plantar flexors have increased EMG activity. The quadriceps have increased EMG activity because now we're loading into that stretch, that eccentric portion. We're lengthening the muscle, but we're contracting, or slowing the rate of speed down to absorb the impact from a jump. And then that amortization phase, that shortening phase, we're exploding upwards. We're getting good calf and quad activation to release the stored elastic energy. Think of this like a spring, the spring-like mechanism of the stretch shortening cycle on the picture on the bottom right. You can see that we can preload the spring rather. It's loads with that elastic properties of the spring is loaded. Once we let go of the pressure on the spring, we get this rebound effect that helps assist in power production. So the importance of elastic components in plyometric training are robust. Plyometric exercises harness these elastic components, particularly the SEC, by utilizing the stretch shortening cycle. Effective plyometric training reduces the amortization phase, which maximizes energy release from the SEC, allowing the CC to generate more powerful contractions with less metabolic cost. And so we will review this on the next slide, I believe. This combination results in improved reactive strength, rate of force development, and power output, all critical for athletic performance in sports that require explosive movements. Here is what I mean when we try to break this down. The CC is contractile component. The PEC, again, is parallel elastic component. And the SEC is series elastic component. We can see this on the picture on the very left. This diagram illustrates the 3 main components of muscle elasticity and force production. Okay, each component contributes to the muscle's ability to generate force, absorb shock, and store or release energy during movement. So when we want to break this picture down, because I know a lot of you will have questions about this, because looking at this schematic in isolation, it's kind of not very robust in terms of what it's trying to present. So if we look here at the contractile component, we're going to locate this in the diagram, the center section with the muscle fibers, as you can see from our classic actin and myosin cross-bridging picture, right? And so what that is the CC's function is the active part of the muscle consisting of the actin and myosin filaments within the muscle fibers. The contractile component generates force through cross-bridging cycles where actin and myosin slide past each other during contraction. We understand that. The role in movement here is that the contractile component is responsible for the active generation of force during muscle contraction. When a muscle contracts concentrically, the contractile component is shortened, and we know this back from kinesiology. So what about the parallel elastic component? Well, when we look in the diagram, it's going to be at the top, and it's going to look like that spring-like structure that are parallel to the contractile component on either side. The function of the parallel elastic component includes the connective tissue structures within the muscle, such as the endomysium, the perimysium, and the epimysium, which surround the muscle fibers and the bundles. So those have more elastic properties that run in parallel to the contractile components. The role in movement is that the PEC provides passive resistance to stretch and stabilizes the muscle. When the muscle lengthens, the PEC contributes to the muscle's overall stiffness and helps prevent overstretching. It doesn't actively contract, right? That's the CC's job, but resist excessive elongation and contributes to the passive tension in the muscle, helping aid in that spring-like effect. Series elastic component, and we locate this on the right side of the screen, the diagram rather. The function of the SEC is primarily consists of the tendons and other connective tissues that connect muscle to bone. The tendons are positioned in series with the contractile elements of the muscle, not in parallel, and that's where we get this differentiation. The role in movement is the SEC is responsible for storing elastic energy during an eccentric contraction, which is then released during a concentric contraction. In plyometric movements, the SEC allows for a rapid release of stored energy when the muscle quickly transitions from an eccentric to a concentric phase, contributing to an increase in overall force output. A lot of information, isn't it? But that breaks down this picture very well. So let's talk now about some neuromuscular adaptations to plyometric training. This is very crucial, obviously, in becoming powerful, is being able to recruit motor units and things of that nature. First, let's talk about muscle spindle activation. This increases sensitivity to stretch, leading to faster reflexive contractions. We need Golgi tendon organ desensitization, which then increases force tolerance by raising the inhibition threshold, and enhance motor unit recruitment. Improve neuromuscular efficiency through rapid recruitment, rate coding, and synchronization. And one of the ways that we increase motor unit recruitment is by increasing the task at hand, if you will, the difficulty or the load of the task at hand. So if we're trying to move rapidly, or something very heavy, we're going to have to increase our motor unit recruitment to be able to adapt to that stress. Here's some schematics that point this out. You can see the picture on the left is looking at kind of this feedback loop between the muscle spindles as well as the Golgi tendon organs. And then the picture on the right is looking at motor unit recruitment involved in different activities. And so this is approximate percentages. I got it from, charliefrancis.com, looks like. So I was looking for a nice diagram and found something that it kind of gets my point across. I don't know if these are exactly right, but the higher level of load or explosivity of a movement, the more motor units you're going to need to recruit to accomplish that task. So we can start at the very right. You have isometric, supplementary lifts. Eventually, we're getting through more stressful movements, higher loaded movements, until finally we're at something like maximal sprints, clean and jerk, snatches, etc. And so the plyometric world kind of lives in this 75 and up percentage motor unit recruitment threshold, and really we might even call it an 8 to 10 or 80 to 100%, I think is how we define it by ACSM guidelines. So what are the phases of plyometric training? There's 3 phases that I like to think about based on the article I share with you. There's the plyometric stabilization phase. The goal here is to establish optimal landing mechanics, alignment, and postural control. An example of this is a box jump with stabilization, or a snap down, or a squat jump with stabilization, holding for 3 to 5 seconds on landing, something to really incorporate in and lock in the mechanics. Then you have your plyometric strength, which is developing eccentric strength, dynamic stabilization, and rate of force production. Think of things like lunge jumps, power step-ups, repetitive squat jumps. Right, this is all a continuum, as you can tell. And then plyometric power. So the goal here is to maximize speed and explosiveness, emphasizing minimal ground contact. Think of things like depth jumps, meaning you step off or jump off of a box, land, try to get off the ground as quickly as you can. Bounding, hurdle jumps. There's many, many more examples, as well as upper extremity examples. So what I want you to do is, when you think of a plyometric exercise, you're going to think about how you can categorize them. This is that OPT, or optimum performance training model, that kind of looks at these 3 phases: the plyometric stabilization, plyometric strength, plyometric power steps. And so it should be a stepwise progression to get to that plyometric power. You need the foundation of stabilization and strength before you can work on power movements. It's pretty obvious statement there. What about training parameters? If you're trying to design training programs, well, we want to make sure that exercise selection is safe. The person's worked up to whatever load you're trying to get them to do. They have supportive surfaces to minimize impact forces. And then in terms of intensity variables, it's based on speed, height, resistance. Think of those 10 movement variables we've talked about in this course. Can you add load? Can you add distance? Can you add height? Can you add differences in environment, surfaces, etc.? You need to think about those variables. Also, think about the variables they might need for their sport. What type of surface are they on? Courts, grass, etc. What about volume control? Monitor foot contacts per session for intensity. Shooting somewhere between 200 and 400 contacts depending on experience level, and that'd be more like running. If we're thinking about jumping and single leg jumping, we're not going to do 200 single leg jumps, right? Or 400 single leg jumps. So there's some variability here. You need to analyze your patient when they're doing some of these movements. What about safety and injury prevention here with plyometrics? Importance of stability preconditioning. Well, when we do plyometrics, the ground reaction forces can increase up to 4 to 11 times our body weight during jumps. So, what's that mean? The person has to be strong enough to tolerate this. Their tissues have to be prepped well enough over the several weeks leading up to plyometrics to tolerate this type of stress. This is a lot of stress, okay? So you have to have stability preconditioning. What about surface and footwear? Well, emphasis on supportive surfaces and appropriate footwear to reduce injury risk. We're not going to start jumping people onto Bosu balls with socks on, right? That's what I kind of think about. If you jump onto a Bosu ball with socks, you got slippery surface because of the socks, and you got unstable surface because of the Bosu ball. Obviously, we're going to start with something much more safe than that, and that's probably not very sport specific. Who's doing that? Okay, and then rest and recovery. After a plyometric training bout, you need a minimum of 48 hours between sessions for neuromuscular recovery and adaptation. I say 36 to 48, but even 72 is probably better. These are other days you can do supplemental training, but if we're working the 80 to 100% RPE threshold with plyometrics, 2 to 3 days off is a really good way to start. So we're thinking about doing training of this 2 to 3 times a week, so we have that good recovery in between. Here are some parameters again from that article. In terms of exercise selection, would be safe, supportive shoes. It's just everything I already talked to you about. And then the variables. This is something we haven't talked quite yet about, so this is why I put this on here. The plane of motion, we're looking at maybe starting first in the sagittal plane, then maybe the frontal plane, then transverse, and then eventually multiplanar. Think about range of motion. Can you start with partial range of motion drills, such as like ankling or pitter-patter feet movements, into then full running or jumping or bounding? Okay. Can you do different types of resistance? Of course you can. Medicine balls, power balls, work on things like have equipment like tape, cones, boxes, etc., that you can manipulate the environment so that you can get a certain training output. We're thinking about our muscle actions. We've already kind of beat that dead horse in this lecture. What about speed of movement, duration, frequency, amplitude? All these things are important to consider in terms of variables in designing your exercise program. How about progression guidelines for plyometric training? Well, again, we think of beginner or novice athletes, intermediate and advanced athletes. So with beginner progressions here, even if it's an advanced lifter that's never done, plyometrics before, they might be a beginner in plyometrics or a novice in plyometrics. So you're going to start with low intensity squat jumps, small box jumps with extended amortization holds for motor control. Intermediate progression would then lead to something like a higher intensity type of jump, such as a tuck jump or a lunge jump with focus on repetitive short ground contact, into advanced progressions, high velocity and height-based exercises, really trying to work on prioritizing reactive efficiency and explosiveness. And so if you can picture us doing a drill, we have blocked versus randomized practice. Maybe I'm having someone run 10 yards, stop, sink into a squat, jump as high as they can to simulate something like maybe a volleyball player having to sprint to the net, jump, and block a like a spike, right? If we're doing that, how can we change? So that's a block practice: run, squat down, jump, block, right? We're mimicking that. So how can we change that to make it more reactive? Maybe we actually do throw a ball in there, right? They run down, they jump. At that time they're jumping to throw a ball, they have to react to it, off balance and hit and go down. So these are ways that we can make this more randomized and sport specific. Here are some examples for plyometric training from kind of beginner to advanced levels. If you don't know what a snap down is, a snap down is simply just starting, going up on your toes, and then snapping down into a squat, where you get a little bit of this feet off the ground, little feet off the ground, and then you land and you absorb that rapid descent of your body quickly. So we're not really going into an amortization phase. We're just going into a snap down into a squat. We're eccentrically slowing ourselves down as quickly as we can and stopping. So a true plyometric would be we do that and then we get out of it, right? And so that's what we do with something like loaded jumps, box jumps, etc. We snap down, get out of it. So anyways, these are different types of plyometric training phasic goals and some associated exercises. So the first one is eccentric absorption, then propulsive development. So we're looking at eccentric, then concentric, then phasic coupling, continuous jumps, and then shock method. Here's an example of that with upper extremity. So again, concentric, eccentric, draw and release. We call it catch and release, repeated catch and release. And you can see some of these different types of exercise, these exercises that are in this continuum. So program design considerations, remember back to that OPT model, the stabilization, the strength, and the power phases for plyometrics, and then load management. We want to progress load by increasing drop heights or moving from bilateral to unilateral. Maybe we're working on more sport-specific movements. Advanced plyometric progressions for athletes. Again, think about multiplanar movements. Sports occurs in 3 dimensions. Life occurs in 3 dimensions. We need to start training them in these different things. Maybe they're eventually getting to a point where they jump with 2, turn 90 degrees, land with 1 leg, right? So now they've done a lot of different power explosiveness, and we're starting to mimic in a blocked way landing patterns, a little off balance and things like that. So we're working proprioceptive capabilities and all of those things. Depth and obstacle jumps, putting obstacles in people's way, whether it's cones, hurdles, whether it's actually making them to react to obstacles, meaning they might be doing a drill, you roll a stability ball and they have to dodge the stability ball. Maybe you have some hit pads and you're trying to hit them as they're doing certain tasks, right? We're doing things to increase and advance the plyometric difficulty. And then, of course, reactive drills. We've talked a little bit about this, simulating game-like scenarios and improving reflexive responses. Thank you guys so much. This has been a fun talk. I like doing this lecture. It's really up to you to get creative with some of your programming here. I think the main thing is you just need to individualize it to the patient and the athlete. Make sure you're meeting them where they're at. And if you can do that, then you're going to do great with plyometric, because it's really fun to challenge yourself on how to get these people better. And this is the fun part of rehab. So thank you guys and have a great day.